Hello, very good evening everyone. How are you guys? Is everything fine at your end? I'm Dr. Sandeep Madaan and we are going to start today's session, and as a part of DAMS family, we will discuss anatomy, the high yielding concepts right for the coming exam, and basically we will be discussing in a crisp manner. Okay, we will be starting in a crisp manner. All right, so let us start. Okay. All right. Okay, so we'll start with the first topic, that is head and neck chapter. In this part, like we have seen in almost all the exams, foramen of skull is very frequently asked area, right? So either they ask directly that which foramen are there, like, and direct question from gross anatomy, or they may ask like some integrated part also, right? Some clinical history will be given, and then they will be asking like, okay, which foramen, which nerve, something like that. So those type of things are asked. And once this question was also asked that which foramen is made up having contribution from three bones, and we can see that this is the foramen lacerum having contributed by this is the sphenoid bone, right? This is the occipital bone, and this is the petrous part of temporal bone. So this is contributed by three bones, right? So if you quickly let us go through this foramen. This is the cribriform plate for the olfactory nerves, and in the initial exam also asked about the COVID virus. This is the optic canal for the optic nerve and ophthalmic artery, and here we have superior orbital fissure for third, fourth, sixth, and the V1 fibers. And this is foramen rotundum for the maxillary nerve, foramen ovale for mandibular nerve, and this is the foramen spinosum for nervous spinosum, and also the middle meningeal artery. Now, middle meningeal artery is one of the very important topic which is asked in your exam. And after that, we have the petrous part of temporal bone, and here we can see that we have internal acoustic meatus, right? And which is allowing the 7th nerve, 8th nerve, and the labyrinthine artery. And here you can see the jugular foramen, 9th, 10th, and 11th nerve, right? This is being allowed to pass. And from the hypoglossal canal, we have basically hypoglossal nerve, right? So that is one of the important area. Now in this diagram, what we can see, let us revise the 7th nerve. In this part, basically we are going to discuss the lacrimetric pathway, one of the very important area from where the questions are framed. The 7th nerve, which comes from the bones, it will enter into the internal acoustic meatus part, and then you can see that it is going to it is going to approach the middle ear, and then it will go behind and then comes out of the stylomastoid foramen. From the bend is called as genu. In general, bend is called as genu. And from the genu, the one branch is given off, that is greater petrosal nerve. And because it is superficial to the petrous bone, the complete name is greater superficial petrosal nerve. And this is which plate? This bony plate is the pterygoid plate. And what is this canal? Pterygoid canal. So this greater petrosal nerve will be passing through the pterygoid canal, but not alone. It will be accompanied by the deep petrosal nerve. What is deep petrosal nerve? The sympathetic fiber. Deep petrosal nerve are the sympathetic fibers along the internal carotid artery, and together they are passing through the pterygoid canal. In this part, we are calling it as Vidian nerve, right? And then reaching the pterygopalatine fossa, where we have pterygopalatine ganglion. Between the pterygoid plate and the palate, we have pterygopalatine ganglion, and further it will be distributed to various regions like nasal part, palatine part, pharyngeal part, and the most important is the orbital part, where we have the lacrimation, right? So this pathway is also called as for the lacrimation, right? So next we can see, if we are observing the petrous bone from above, we can observe that this is the greater superficial petrosal nerve, the yellow one. Deeper to this part, we have this blue color structure, that is deep petrosal nerve, and together these two will become the nerve of the pterygoid canal, which is also called as Vidian nerve, right? And here you can see one more hole is there, that is for the lesser petrosal nerve, which will be coming in this part by piercing the bony plate, right? And now this area is like although the initiate exam very frequently asks this type of questions, they give one section and then they will ask to identify the nerve. So this is very important for us to identify all the structures here. So here in this part, cribriform plate, we can see this is cranial nerve 1, this is cranial nerve 2, this is cranial nerve 3, this is 4, and this is 5. Fifth nerve is very easy to identify because in the given section it will be the thickest, right? After fifth we have 7th, not the 6th. Why? Because 6 has gone here. Now one hint for you guys that we have all the nerves arranged this way, but the 6th nerve is going this way. Okay, because it has to pierce this dura part, it will be entering into the Dorello's canal, right? And after this 7th nerve here, you can see the 8th nerve, 9th, 10th and 11th nerve. This is the 12th nerve. So these are some important area from where the direct questions are asked, right? So I have put some this different labeled images, okay, what we have already just now discussed. And this is the dural venous sinus, because we know in this cranial part of the dura we have two layers, one along the bone, right, this layer, and one along the brain matter. This is two layers of the dura are there. The bony layer is continuous along the bone, but along the cerebral part that we have between the two cerebral hemisphere, we have some gaps there, right? So that part of the dura will be dipping inside. That dipping inside of the dura is going to make one fold. This is called as dural fold. And what are the names? Falx cerebri, falx cerebelli, tentorium cerebelli. But because these two layers are getting separated here, so dural venous sinus is nothing but the dilated veins which are present here, okay, which can be asked in our exam. And particularly these are the dural venous sinuses. Let me give you a quick review here. This is superior sagittal sinus. This one is the superior sagittal sinus. This one is inferior sagittal sinus. Together this is straight sinus, right? And we can see here that these two are internal cerebral vein, left and right, deep cerebral vein, which will join to become the vein of Galen, which will also join into the straight sinus, right? And from below we have occipital sinus coming up. So these sinuses, superior sagittal, occipital and straight, they are meeting at this part that is called as confluence of sinus, right? And then it will be distributed into the transverse part. Transverse will eventually become sigmoid, and sigmoid will continue as the internal jugular vein. And we can see the inferior petrosal sinus is going to join the internal jugular vein. It becomes one of the tributary, right? So this is important area. And also what we need to know is the tributaries of the cavernous sinus, okay, relations of the cavernous sinus and the the drainage of the cavernous sinus. So this part are important, okay. And what is this muscle? If you can identify this for me, you can see this is the ramus. Outside the ramus is the masseter. Here we have the temporalis muscle. This is the lateral pterygoid, and this is the medial pterygoid muscle. So basically we need to identify the muscle in this given section, and then of course they will ask some related question related to this part, right? I have put this labeled image for your practice later on. Now this area is like very, very important area. Pterion has been asked number of times, okay? And what do they ask? Which artery is present deep to it? We all know it is the middle meningeal artery, which is a branch of maxillary artery. Which part? First part. And now in this exam also there was a question, which division of the middle meningeal artery will be lying deep to the pterion? That will be anterior division, and that is the one which is responsible for the most common cause of extradural hemorrhage. Okay, so all these points are important for middle meningeal artery. It's one of the very hot favorite area. Okay, next of course we need to know the branches of the maxillary artery, which can be asked in your exam, along with the branches of subclavian artery also, right? Now looking at this azygous vein part, basically they can ask more importantly, they ask the superior intercostal veins, because that is different in drainage on the right side and the left side. Left superior intercostal will be draining into the left brachiocephalic, whereas the right side it will be draining into the azygous vein, okay? And rest of the veins will be directly draining into the azygous vein on the right side, whereas on the left side 5th to 8th into accessory hemiazygous and 9 to 11 into hemiazygous. So posterior intercostal veins are basically having difference in their drainage, right? So that is where the questions are framed, okay? Now what we can see here is the diaphragm. The diaphragmatic openings are important for us. Like we have the vena cava opening, we have the esophageal opening and the aortic opening. and these openings are present in the different parts of the diaphragm, so they behave differently during the inspiration phase. In the inspiration phase, IVC opening will dilate, esophageal opening will constrict, and there will be no change in the aortic opening. And also we need to know what are the other structure which will be passing through these areas. Along with that, minor areas are also there, like this is the lateral arcuate ligament for the subcostal nerves and vessel, middle arcuate ligament for the sympathetic chain, and then this is the right crus and the left crus. Who will be piercing the right and left crus? The splanchnic nerves. Okay, and also along with this part, for the diaphragm particularly, the development of diaphragm is also very, very important. In this part, we need to basically remember which part of the diaphragm is coming from which source. Okay, and pleuroperitoneal membrane here, sometimes there is a defect, and this defect leads to the most common type of congenital diaphragmatic hernia. And in this part, what we can see is the root of lung. What is root of lung? Is the extension of the pleura, which is covering the lung, right? But pleura is giving an extension along the structures which are passing through this part. So that extension is called as root of lung. This extension around the structures is called as root of lung, and it is different in the right side and the left side. That is why the questions are framed here, right? You can see the root of lung having different arrangement. One bronchus on the left side, but two bronchial arteries on the left side. Whereas right side we have two bronchi, one below the artery, one above the artery. But two bronchi are there, but how many artery? Only single, one bronchial artery is there on the right side. Okay, so this question was also asked in the recent years, very, very important area. Along with this, what is the other important area in this part is the bronchopulmonary segment. Direct questions like gross anatomy can be asked, okay, because the pulmonary veins are intersegmental, arteries are intrasegmental, and these are surgically resectable. All these points are important. Along with that, question can be framed in a clinical setting, that the patient had the episode of the vomiting, there was aspiration, where which particular segment the vomitus will be there, where the consolidation will be seen, right? All those aspiration related questions can be asked. All right. So here we can see this mapping of the tertiary bronchi have been done in all the surfaces. You can see the color mapping, right? Why it is done? Because now we are able to do the segmentectomy, lobectomy, or the pneumonectomy depending upon the clinical scenario. But everything is doable. It has been extensively studied, right? Now, this is what is the pericardium. Now, particularly pericardial sinuses. This is important for us because we can see the aorta and pulmonary trunk enclosed by one tube, that is arterial tube, all the veins enclosed by another tube. So between the arterial and venous tube, we have the transverse sinus, and here we have the oblique sinus. This transverse sinus we can use to pass the ligature, and the oblique sinus behind it, we have the esophagus present. Now, if it is esophagus, who will be in front? Just anterior to esophagus will be left atrium. That we need to remember, okay? And also, please go through the coronaries. Okay, the right coronary supply, left coronary supply, particularly they are going to supply how much part of the septum? Anterior 2/3 by the left coronary artery, posterior 1/3 by the right coronary artery. On the diaphragmatic surface, it is majorly the right coronary circulation in the form of posterior interventricular artery. Okay, so different type of infarction can be given on different walls, and accordingly you have to mark the artery involved. Okay, and also we need to know about the venous drainage of the heart coronary sinus, particularly those veins which are not draining into the coronary sinus, right? Now, next, what is important is the inguinal canal, and we can see in the inguinal canal, this is the external oblique muscle, right, which is the flat tendon of the external oblique, which is called as aponeurosis here. It is making anterior wall all throughout. And you can see the roof is formed by the arch fibers of second layer and the third layer, internal oblique and the transverse abdominis. Both of them are becoming the conjoint tendon here. And behind, continuous posterior wall is formed by the fascia transversalis. Inguinal canal, inguinal anatomy, the whole region is very, very important. Questions are asked from this region. And lower down you can see the inguinal ligament here, right? Spermatic cord, what are its content? All those related questions which can be asked here, right? And we know that when the testis descends, it gets the coverings, right? Which are nothing but the continuation of these layers of the abdomen only, right? And transverse abdominis will not make any covering because it lies lateral to the rings. Okay, so this is one of the important part which we need to understand. And during the descent, if everything fine, that's very well and good. If it fails to descent, there are two options, like it can be incomplete, then we call it as cryptorchidism, or if it is small descent, we call it as ectopic testis. And with respect to the direct and indirect type of inguinal hernia, the Hasselbeck's triangle is very important, which is bounded by the rectus abdominis, inguinal ligament, and the inferior epigastric artery. And the important point is, if the hernia is lateral to it, is the indirect type, medial to it will be direct type of hernia, right? And please go through these blood vessels of the GIT, the branches of the abdominal aorta, like the overall abdominal aorta branches are very important, and particularly the details of celiac trunk, superior mesenteric artery, and the inferior mesenteric artery. How the marginal artery of the Drummond is formed is also important, and the branches to the appendix, like appendicular artery is a branch of ileocolic, and the Sheshachailam is a branch of posterior cecal. So directly asked questions are from this region, right? You can see the celiac trunk branches are important. As I said, superior mesenteric, inferior mesenteric. This blood supply is like one question you can expect in your exam, right? Inferior vena cava tributaries, right? That you can remember along with the, if you read the abdominal aorta branches, along with that you can go through the inferior vena cava tributaries, very similar. And now coming to the peritoneal region, two questions are like repeatedly asked areas, okay? One of them is the development part, the ventral mesogastrium derivatives and the dorsal mesogastrium derivative. Ventral mesogastrium derivatives are by and large falciform ligament and the lesser omentum, along with that triangular and the coronary ligament, and also behind the stomach in the dorsal mesogastrium part we have the spleen present. So there we have gastrosplenic and the lenorenal. Also we have gastrophrenic and lower down greater omentum, right? Very good evening everyone. Yes Abhilash, video रहेगा है ना, वीडियो रहेगा, अभी आप लाइव भी सुन सकते हो, बाद में भी you can just revisit this part, okay? ठीक है, कोई अगर आपका डाउट है तो अभी आप लाइव सेशन में भी पूछ सकते हो, alright? Now this area, particularly epiploic foramen, is like frequently asked area. Number of times the question has been asked, and they usually ask about the walls, like which is like anteriorly present, superiorly, inferior and posteriorly, and also they sometimes ask the structure present in the free border of this lesser omentum, which is nothing but the portal triad structure, which we can see in this diagram, right? This is the right free margin of the lesser omentum. In the like inside we can see the portal triad structures are present, all right? And this relation of the gallbladder, here you can see the new boundaries of the Calot's triangle. That is the updated boundary, basically common hepatic duct. This is the cystic duct and this is the cystic artery. This smaller triangle is the Calot's triangle, updated one. Also another part, fundus is related to the transverse colon and podi related to the duodenum, right? And this ligament is the phrenicocholic ligament, which will prevent the downward growth of the spleen. Okay, and if you look at this way, the kidney exposure is done from behind. So this Morris parallelogram, these levels may not be asked as such, but the layers which are reflected in order to read the kidneys can be asked, because that is direct relation to the thoracolumbar fascia, right? And anal canal, particularly three parts, upper, middle, lower, and we have pectinate line. That is very important, because at the pectinate line we have upper part and the lower part, which is like having contrasting feature between the two, है ना? इसमें सारे parts are different, okay? इसका development, lining epithelium, arterial supply, venous drainage, everything is different, and that we should remember. Now this is what I was talking about, the layers to be reflected to reach the kidney. Here you can see this is the psoas major muscle, this is quadratus lumborum muscle, and this is you can say here we have erector spinae group, okay? And this one is basically, you can see anterior layer, middle layer, and the posterior layer of the thoracolumbar fascia, which is connected to these two muscles also. So this arrangement and the layers to be reflected is important for us, right? Now internal iliac artery, like one of the very important area is the artery of the pelvic cavity, and that directly ask questions like what are the branches from the anterior division, what are the branches from the posterior division. Very frequently asked area, we should always particularly see this part, right? Now prostate, here various things can be asked. One of the important area is the internal urethral sphincter, which is the pre-prostatic part of the urethra, which is well developed in males because it will prevent the retrograde ejaculation, but it is poorly developed or absent in case of female. It's not functional because to prevent it, there is no ejaculation, so there is no role as such. Okay, this is one part in the prostate. What other things can be asked is the prostatic venous plexus and their connection, because CA prostate case is there, so accordingly it can spread to the various areas. Okay, the lobes and the zones of the prostate are also very, very important. Those are more important for the surgical point of view, right? Now, in this upper limb part, what are the areas which are like of utmost importance? The branches of the axillary artery, very, very important. Let me just quickly show you. We can see the subclavian artery and the first rib. As soon as it crosses the first rib, it is called as axillary artery. It will give this branch superior thoracic artery, acromiothoracic artery. Acromiothoracic will further give this branch to the acromion, called as acromial branch, to the breast or the pectoral part, right? This is the clavicular, this is the deltoid branch. Here we have the lateral thoracic, subscapular artery, and this is anterior and posterior circumflex humeral artery. In short, we call it as Acha and Pacha, right? Just to easy way to remember this. Okay. Now, brachial plexus. After axillary artery, brachial plexus is one of the very important area. You need to go through it, that formation, the names of the branches, and also the injuries. Particularly, injuries are more important. Obs palsy, this is the Obs palsy, and what will be the presentation? Policeman tip deformity, right? And what will be the position of the arm and forearm? That is also asked in the exam. Okay, and this is what is the Klumpke's palsy, where the lower trunk is gone, and this will lead to the claw hand plus Horner syndrome. Okay, and along with that, rotator cuff muscles also you must go through, and palm muscles of the palm, again one of the very important area. You can expect one question from this region. Okay, and here you can see we have the thinner group, hypothinner group. We need to know the names of the muscles, and we need to know the basic identification also. So we can see abductors and the flexor on both sides, right? Abductor and the flexor. But if you make one cut, you go one level deep, you will reach the opponent's pollicis, right? And very deep will be this adductor pollicis. And here you can see these are the lumbricals muscles which are taking origin from the flexor digitorum profundus tendon. Okay, and if you see this way, this is the palmar introsei will be absent on the middle finger because it cannot be adducted, it is already in the axis. And the dorsal introsei will be absent in the thumb and the little finger, and it will be 2 in the middle finger, one for this side, one for this side. Why? Because middle finger can be abducted in both the sides. Okay, so please remember these are all important areas from where the questions are asked. Now these signs like Tinel sign, Phelan test, card test, Igawa test, book test, these are directly asked questions based on the nerve injuries. Okay, and again this is an overlapping area with the orthopedics. So, but you should remember these names of the test, and for which nerve, for which muscle we are doing, that is also very, very important. Right, Froment sign. Now, this is what is the lumbar plexus. Here you can see this is what is the T12 fibers. This is iliohypogastric, ilioinguinal. This one is genitofemoral nerve, lateral cutaneous nerve of thigh. This one is femoral, and this one is obturator. Okay, these are the branches of the lumbar plexus. Lumbar plexus is also important. Lateral cutaneous nerve of thigh, if it is involved, can you tell what will be the name of the condition? Lateral cutaneous nerve of thigh, if it is involved, it will lead to the myalgia. Now, this particular area, like superior gluteal nerve, supplying the gluteus medius and minimus, and then Trendelenburg sign, and then the lurching gait, waddling gait. This is again one of the very important area from where the questions are framed. So please remember gluteal nerves, gluteal muscles, their action, and particularly Trendelenburg sign. Okay, so this is what you can see. That is the what we can see here. We have superior gluteal nerve, we have inferior gluteal nerve with respect to this piriformis muscle. Okay, this is gluteus maximus that we have cut. Then we go deeper, gluteus medius, when we cut gluteus minimus, right? And here you can see the quadratus femoris muscle. And this is what we have, the lateral aspect of the ankle, where we have these 3 components. Medial aspect of the ankle, where we have these 4 components of the ligaments. These components are important to know. Why? Because in case of injury, there will be this ligament will be torn, right? If this is normal, in case of inversion, stretch will be on the lateral part. In case of eversion, stretch will be on the medial part. Alright, accordingly, any of the component of that particular ligament can be injured. Okay, but trick is in the medial ligament, the tibial word will be definitely there, and in the lateral ligament, fibular word will be definitely there. So you can quickly catch the answer, right? Now this great saphenous vein and the short saphenous vein, one of the very important area, and particularly last two exams, the question was, if you take a grafting from here, which nerve is at risk of injury? The saphenous nerve is at risk of injury because the saphenous nerve is accompanying the great saphenous vein. Okay, and here you can see the saphenous vein is terminating into the femoral vein. These points are important for the great saphenous vein, short saphenous vein. Short saphenous vein, it begins at the lateral aspect, but it does not run in the lateral leg. It rather runs in the posterior leg. It terminates into the popliteal vein here, and it is accompanied by the sural nerve. All right. Now, dear students, along with this part, we need to know particularly neural crest derivative or pharyngeal arches or pharyngeal pouches. These three particular parts, one question you can expect. Okay, so in almost all the exams, they ask this type of question either from the neural crest derivative or from the pharyngeal arches or from the pharyngeal pouches. These are must do topics. Okay, please remember this. All right. And regarding the histology, there are certain areas which are very frequently asked, but you must go through the basic of the histology. So in this slide, basically respiratory epithelium is shown. If the cartilage is present, it is up to the bronchus. If it is absent, it is bronchiole onward. Okay. And if you observe, the epithelium height is it is slowly reducing in height, and eventually at the level of alveoli, we have type 1 and type 2 pneumocyte. Type 2 pneumocyte has got two roles. One is stem cell, second is the production of the surfactant, right? And now if you can tell me the answer of this question. Yes, dear students, can you identify this slide? What is this slide and where this is present? This slide is hyaline cartilage because we can see the cells in groups present, fibers not present in between. And this is seen at the epiphyseal plate because the word disc, you should immediately think of fibrocartilage. Okay, this is fibrocartilage, this is also fibrocartilage. Pinna is elastic cartilage. Is that okay? All right, could you understand? Next, if you can identify this slide, this is one of the very important area, right? And that is what is the cerebellum. Cerebellum, we have basically the Purkinje cell, molecular cell, and the granular cell. And in the this part, what has been marked is the Purkinje cells, right? And Purkinje cell will be, you see, inhibiting to what? Deep nuclei of the cerebellum. In the neuroanatomy part, again, what is important for us is the cerebellum, right? Cerebellum is one of the important area. Apart from cerebellum, what else we need to know? Definitely, we need to know about the basal nuclei. This ballistic movement, hemiballistic movement, caudate nucleus, that is Parkinson, this movement disorder, one question you can expect. Okay, cerebellum, definitely one question you can expect. Thalamus, on and off, they ask the question, right? And also the floor of fourth ventricle is very, very important. Okay, floor of fourth ventricle and the blood supply. These three areas from the neuroanatomy you must go through. All right. Now, if you can identify this for me, yes, dear students, what is this? Yes, can you write in the chat box? What is this? This is the islet of the Langerhans. One of the identifying criteria is this is like size is very big if you compare with the surrounding acini, and also inside you can see the blood capillaries, vessels will be present because this is endocrine tissue, so it will not have any duct system. Okay, so we can see this is the islets of Langerhans, okay, which is seen in the pancreas. And what is this space? Here you can see these are the hepatic cells in the hepatic plate. This is the sinusoid. Between these two parts we have this is nothing but the space of Disse. Okay, this is space of Disse. The question is sometimes asked what structure will be present, what will be not present, like that. So what we can see, this is the space of Disse, this is the sinusoid. Okay, this is the sinusoid, this is the hepatic plate. You can see between the two we have space of Disse. And what will be seen here, that will be hepatic stellate cell, that is the Ito cells. But what will be not seen here is the Kupffer cell. Now Kupffer cells are present in the sinusoid. So we can say they patrol along the space of Disse, not in the space of Disse. I hope this part is clear to you now. Yes. So remember dear students, those who understand हिंदी, लक्ष्य को हर हाल में पाना है. अभी हमारा एग्जाम बहुत क्लोज है ना. अभी हमें गिव अप नहीं करना, रादर हमें बेस्ट शॉट देना है. अपना बेस्ट दो, बाकी रब रखा. ओके, रिमेंबर दिस. ठुकरा दिया जिन्होंने मुझे, मेरा वक्त देखकर कसम खाता हूं ऐसा वक्त लाऊंगा कि मिलना पड़ेगा मुझसे मेरा वक्त लेकर. ऑलराइट, एंड those dear students who do not understand Hindi, for you guys, please remember this very, very beautiful lines. If you do not sacrifice for what you want becomes the sacrifice. अगर आप आपकी चाहत के लिए बलिदान नहीं देंगे तो आपकी चाहत ही बलिदान हो जाएगी. इसलिए dear friends, मेहनत करनी पड़ेगी, बलिदान देना होगा. All right, please remember, only thing in your control is effort. That's all and that's everything. Okay, all the very best. All the very best. This is me, Sandeep Madaan, and this is my detail like Telegram and Facebook and the Insta. At any of these platforms, you can get connected with me. If you have any doubt, if you want any plan to discuss with me, any sort of a discussion, kind of like if you are finding any difficulty in some of the areas in the anatomy, or if you want to know how to prepare and all, those questions are all welcome. Okay, all the very best. God bless you all. Thank you so much, everyone.